Hello and welcome to the Health for Mzansi podcast, where we bring you inspiring stories from the front lines of medicine. I'm your host, Donumdu. Today we share the beautiful story of Nuraan Samuels, an oral hygienist at the Red Cross Children's Hospital in Cape Town. She has dedicated her career to improving the oral health of children, particularly those with special needs. Her journey is a powerful reminder of the difference one person can make in the lives of others. Inspired by her parents, particularly her mother, she found herself drawn to the dental field. But it is her exposure to special needs education that truly shaped her career. Here's her story. Nuraan, welcome to the Health for Mzansi podcast. It is an absolute pleasure to be chatting to you today. I am so happy to pick your brain on all things dentistry and also more about your journey in the healthcare sector. Welcome to it.
Hi, Dawn. Thank you so much for having me.
Nuraan, you grew up in Mitchell's Plain in Cape Town, and this is where you really developed a strong appreciation for community service. Can you maybe share some of your experiences or moments, from your childhood that inspired you to pursue a career in oral health, and particularly focusing on children with special needs?
Growing up, I always enjoyed going to the dentist with my mother and my father. And I was always really fascinated by the instruments that they used there. And from that moment on, I knew I wanted to pursue a career in oral health. But my interest for working with special needs children grew was when I was in high school. And I had to do a presentation on just anything that I was interested in. And at the time, my mother was studying early childhood development at the College of Cape Town. And for one of her assignments, she had to go observe at a special needs school. And I remember her coming home and telling us all about the experience that she had there. I was very interested in learning more about special needs children. And then I ended up doing an entire presentation on children that had cerebral palsy. And from that moment on, I knew that I wanted to pursue a career in oral health and work with special needs children as well.
That's amazing. So your inspiration really comes from your mother. And it's so weird. Most kids are afraid of the dentist. This is me. I'm excited.
Yeah.
It's amazing. My son, he's 6 years old. Any talk of going to the dentist, he's like, no. But that's really cool. I love that. We're just going over some of your work experience. You worked at the Red Cross Children's Hospital. Could you provide some of the most valuable or at least some context to the most vulnerable populations? What are some of the biggest, challenges that you face in this role? And what rewards, keeps you motivated to continue your work in the public sector specifically?
One of the biggest challenges that I do face is when I provide parents or caregivers with advice on how to take care of the child's teeth at home. And I can see that it's not being implemented at home at their next visit. And this usually makes it a repetitive problem to solve as the child comes back with the same issue every time. And this is because many parents and caregivers, they find it really difficult to manage a steady routine to take care of the child's teeth at home. And this is because the child's medical conditions takes first priority. And that's why I always stress with them the importance that they need to be taking care of the child's teeth at home. And I'd always explain to them how the child's medical conditions can affect their oral health. With regards to keeping me motivated is I always remember why I'm doing this job. And that is not only just to help the children, but it's also to help the parents and the caregivers manage their child's oral health at home. For me, this job is so very rewarding. And it's not just because I get to help, but I get to make a difference in their lives.
And I actually just want to quickly sidestep a bit to find out a little bit more of your studies. So like when you finished high school, before you started this work at the Red Cross Children's Hospital, if you can just share a bit of a timeline as to the studies you had to go through to be able to qualify as an oral hygienist.
My degree, it's a 3-year degree that I did at the University of the Western Cape. And during my training, I was based at various hospitals where I did my practicals there. So I was working at Malomade in Mitchell's Plain. I worked at Tygerberg Hospital. I was at the Day Hospital in Mitchell's Plain as well. And I was even working at Groote Schuur Hospital as well.
Your expertise in handling diverse cases, and I think we spoke about this briefly and you've alluded to this as well, especially, involving special needs children, is really commendable. Can you maybe describe, some of the tailored approaches that you use to meet these unique requirements of these children and how you really ensure that they're comfortable and respected during these visits?
At the hospital, I treat a variety of children that have physical, intellectual, and developmental disabilities. So I always try to make sure that my approaches are flexible and that they are tailor-made to the needs of the child. And I always take into account these things before I treat any child. And that is communication. Some children with special needs, they might have a difficulty in communicating their needs and expressing their discomfort verbally. So I'd always use different communication methods. Like I would show them on my tooth model, or I would work with the caregivers and the parents to understand their level of comfort of their child and their potential anxieties. Some children, they are also very sensitive to the dental environment, like with regards to sound, taste, and smell. So I always make sure that I set up a sensory-friendly workspace. And to ensure comfort and safety with children that have any physical disabilities, our dental clinic has enough space to accommodate children that are in a wheelchair. I always make sure that I make the necessary modifications to the dental equipment before treatment. I always make sure to also review the child's medical history with the dentist and the doctors, because the child's medical conditions can affect the oral health and the treatment options as well. So we always make sure that we work together as a team in order to provide quality healthcare for the child. With regards to making the child feel comfortable and respected, the dental assistant and I, we always make sure that the dental clinic, it feels warm and welcoming, and we always greet them with a big smile on our faces, and we make sure to validate the emotions during their dental experience. And I'd always make sure that I first explain to them what I'm going to be doing beforehand so that they know what to expect. And I always make sure that I work very gently with in order to make sure that they feel comfortable.
I want to come to your places. So welcoming, like it's so easy and, light. And I think that's definitely what you want. And when you approach something, I know so many people are fearful of going to the dentist, but you make it so warm. So that's lovely. Now, you believe that a healthy smile is foundational to a child's overall well-being. How do you communicate the importance of oral health to families and caregivers? And what tips do you provide to maintain their children's oral hygiene at home?
So I would explain to them and show them how they need to brush their child's teeth at home, that they should be brushing twice a day. I would explain to them how cavities form inside of the mouth. I would explain to them how their child's medical conditions can affect the oral cavity. I would explain to them how the child's diet can contribute to the oral health. For babies, I would explain to parents that they need to start brushing their child's teeth once the first tooth erupts inside of the mouth. I would explain to them the effects of breastfeeding and bottle feeding on the child's mouth. I would tell them that they need to use a fluoridated toothpaste and teach the kids how to spit out at a young age. And I'd also tell parents that they need to bring their child every 6 months to see a dentist, go see an oral hygienist for regular fluoride treatments and for regular cleanings as well. And just to make sure that if there's any cavities forming inside of the mouth, that we can pick it up early and treat it early.
Thank you so much for sharing that, Nuraan. Can you share, some of the most rewarding experiences, working as an oral hygienist at the Red Cross Hospital, particularly dealing with, medically compromised children and those with special needs? I think you've alluded to this a little bit earlier, but if you can just maybe share one or two highlights that you really keep in your heart.
That would have to be once I've just finished a cleaning for a child that I can see really needed it, or when I have parents come to me and they tell me that they really appreciated how patient I was with the little one and that I really did a good job. I really love working at the hospital and working with children, and I always tell everybody that those kids, they are my blessings. And I really believe that all children are special and unique in their own way, and that they should be loved and cared for, irrespective of gender, race, or disability, and that they all should be treated as equal citizens.
Now, Nuraan, your career highlights your proficiency in applying fissure sealants and managing the behavior of uncooperative children during dental procedures. How did you develop these skills, and what techniques do you find most effective in creating a positive dental experience for these children?
As a student, I used to work at the day hospital in Mitchell's Plain, and that's where I learned the skills to work with children and how to be patient with them and how to manage them during their dental treatment. The techniques that I find most effective with working with children is to show them and explain to them what I'm going to be doing beforehand and make it fun for them. Like I would give all of my instruments a silly name, and this would make them feel less afraid of them. And at the end of the dental visit, I would always offer them a reward like a toothbrush or a toothpaste or even some stickers. And this way the child can associate the dental visit with a positive experience.
Like I said earlier, something that I wouldn't like to have growing up as a child. Maybe I could relive it as an adult. You pursued a bachelor's in oral health at the University of the Western Cape, like you mentioned earlier. How did your academic training really prepare you for your practical challenges? I think you mentioned going to these different hospitals. You listed it earlier. How did these experiences really stand out? How was it particularly influential in your day-to-day practice today?
During my studies, we learned about special needs children, and we learned how their medical conditions can affect their oral health. So learning the theory allowed me to apply what I learned clinically in order to treat my patients. As a student, I also went on many outreaches where I did volunteer at special needs schools, and there I taught children oral hygiene education, how to brush, how to take care of their teeth. I would apply fluoride treatments on their teeth. And this really helped me gain the experience and the confidence to work with special needs children.
And then just going over a little bit of your timeline in terms of your career, you've also worked as a locum oral hygienist and a dental assistant. How did these roles specifically, contribute to your overall professional development, and what insights did you gain that you can kind of use in your current practice at Red Cross Children's Hospital?
Working in these roles has helped me gain so much experience in the field, and it has taught me to work independently if I needed to, and it also taught me how to collaborate with other practitioners in order to treat the patient.
And then you also have a number of certificates that you've obtained over the years, such as the ALMIX Meridor Student Training Certificate and your participation in the Dream Girls Academy. How have these additional programs and seminars influenced your approach to oral health care? And how did you incorporate, this knowledge into your daily practice?
So those programs like the ALMIX Student Training, that really helped me to understand the science behind the toothpaste and how it works to relieve sensitivity. So now I know how to advise my patients on which type of toothpastes they need to be using based on their oral conditions.
I'm learning so much about oral health care as well. Thank you so much for being here and for sharing a lot of your knowledge and experience that you've gained over the years. Now, just in terms of wrapping up this interview, looking ahead, what are your goals and aspirations for your career in oral health? And are there any specific initiatives or projects that you hope to undertake to further improve the oral health care of children, particularly those with special needs in your community?
My goals for oral health is consistent growth, and that is to be able to better my skill. And one day in the future, I do hope one day to study dentistry and pursue a career in that. With regards to projects, we do have Oral Health Month that is coming up in September. And my colleagues and I at the hospital, we are planning to do a oral health promotion program where we will be providing parents, patients with oral hygiene education, and we're going to be handing out toothbrushes and toothpaste. So I'm really excited and looking forward to doing that.
I know that there's a lot of these drives, and I think the information, aspect of it, like understanding why brushing twice a day is important, is a really element that is vital. I remember as a kid in primary school, there was a whole demonstration that I remember going through, and we were so silly about it, but now I understand the importance of it. Maybe you can share a short message to anyone who has aspirations of following, your career, what they should be aware of. Also just a message to your fellow colleagues in the healthcare sector.
With regards to studies, just make sure that you have the right subjects when you apply for university, like you need. For my degree specifically, I just need maths, and you need to do life science. So make sure that your marks look great and that you work really hard in matric in order to get in. The degree itself, it is quite a lot for oral health to do in 3 years. So there's going to be long nights of studies, but the end result, it's amazing once you get to see all your hard work being put to use at the end of the day. With regards to all of my colleagues working in health, I would like to say that I am very proud of every single one working in health. It's not the easiest job. You need to have the most patience and be most understanding. We really go through a lot. This job really it humbles you because you get to see what your patients go through, especially in the public sector. Those parents and those grandparents, they really go through so much and they love those children with everything they have. And I would just like to say that you guys are doing an amazing job. Keep up the good work. Let's give all of our patients the proper healthcare that they deserve.
Thank you so much for joining us here on this podcast. Oral hygienist, Nuraan Samuels. Your story is a testament to the impact that one dedicated professional can have on the lives of children and their families. I hope that you enjoyed this podcast as much as I did. We hope that Nuraan's story in Mzansi's healthcare sector has left you motivated and informed about the vital role oral hygiene plays in overall health, especially for vulnerable populations. Until next time, greetings from me, Donumdu, our technical producer Megan van de Vent, and the rest of the #team Health for Mzansi. Stay inspired.